And welcome to today's IPHAM webinar. Our webinar today is with our guest Peter Orris and special guest Rebecca Levin. Today's discussion is part of a recurring series that we've called Explorations of Careers in Public Health, where public health leaders share insights about their own careers and important prevailing public health issues. For this webinar, we will again use a Zoom Q&A format. This means that you'll have opportunities to ask questions of our presenters by clicking the Q&A button at the bottom of your Zoom screen. Please do not use the chat function because we will not be monitoring that for your questions. Use the Q&A button. Dr. Peter Orris, our facilitator, is Chief of Occupational and Environmental Medicine at UI Health. It has more than 4 decades experience practicing internal, occupational, and environmental medicine at Cook County Hospital and other institutions in Chicago. He's also a faculty member in the Department of Preventive Medicine here at Northwestern. Rebecca Levin is a senior advisor with the Cook County Sheriff's Office who serves as lead internal public health expert on control of COVID-19 among Cook County jail detainees and Sheriff's Office employees. It is my pleasure now to turn the microphone to Peter and Rebecca. Thank you both. Peter?
Thank you, Ron, and welcome everybody. Thank you, Rebecca, for being with us. This is a firmly rooted part of our seminar series. Firmly rooted meaning coming from and within the Northwestern community, and specifically in response to, over the years, in various courses, there has been on and off criticism about not emphasizing those students in the room that are doing their master's in public health as the final degree within their educational training prior to moving into a career in the field. So many of the Northwestern students are doing the MPH as part of an MD or as part of a residency in OBGYN or pediatrics or other. So today is the day to highlight the possibilities, contemporary possibilities of an MPH within the current healthcare system and really the variable possibilities as such. And to do so, Becky has agreed to join us for this exploration of her career to this point. Rebecca Levin was a undergraduate of Northwestern University emphasizing biology and medical sciences, I think. That was the joint major, was it?
The integrated science program. It combines biology, chemistry, physics, and math.
Having finished that, she decided, and having touched her toes into state politics, if you will, she went to Springfield to be a staffer in the legislature, in the research office. Can you describe that and tell us why and what was the motivation there?
Sure. So I always knew that I wanted to do some sort of work that combined science and public policy. And so after undergrad, I worked for a year at a community center in the Pilsen neighborhood of Chicago. I was the administrative assistant. I knew that even though I wasn't cut out for a career in any sort of direct service, I just don't have the temperament for it. I wanted to spend a little bit of time more on the ground in the community before I shifted in a policy direction. It felt important to have that grounding. And so when I finished up that position, I took a year-long internship with the Illinois General Assembly, working for the Legislative Research Unit to really kind of shift in that policy-oriented direction. Our role in the Legislative Research Unit, and keep in mind this was in 1998, 1999, so it wasn't quite as easy for legislators to have all of the information in the world at their fingertips through Google. They didn't have smartphones in their hands when they were on the floor of the legislature. So they would call us and ask questions. You know, what do other states do to tackle this policy issue? And so it was a great opportunity learning how to write factually, clearly, concisely for policy relevant purposes. It was also the way that I got introduced to public health and health services. I was because of my background with a biology and integrated science major, I was the quote unquote science research intern among the 4 interns. And so each of the science research intern got assigned things that were the most science relevant topics. So the person the year before me did a lot of environmental work. At the time when I was working there, there was a lot going on with healthcare and healthcare reform. And so I got assigned those topics and just really got interested in it. I was also living in Springfield for a year, so it was fairly boring. And through our internship, we were enrolled as students at the University of Illinois at Springfield. So I decided to take an evening class just to have something to do to occupy some time. So flipped through the course catalog, which at the time was a physical course catalog, and saw this class on public health policy. It sounded interesting. I didn't really know what public health was, but I took that class, and that kind of really launched my public health career.
And we won't go into at what hour they rolled up the sidewalks back then in Springfield, but we understand it's been extended somewhat today, but not a lot. But there you discovered public health. What did you feel was necessary? Because from there you went to University of Illinois in the School of Public Health to get your master's in public health and health policy administration, I believe. And was this did you feel the need for this credential career-wise, or was this a content area and a discipline, if you will, that you needed in where you wanted to go now in that interface between the science and policy?
Yeah, I think both. I think the credential can certainly be helpful, but more than that, it was really getting the training in public health as a discipline. So, you know, I took this one class. I had this brief introduction to what public health was through a policy lens, but I hadn't had any training in the discipline, in the essential functions of public health and the core competencies. You know, I didn't know anything about biostatistics. I probably couldn't have told you what epidemiology was. And so I knew that this area of public policy really appealed to me, the idea of working on the health of populations rather than just the health of individuals. And I knew that I needed more knowledge to be able to do that.
And with that under your belt, that was a 2-year program at the time?
So I actually went part-time because I had been working for 2 years at that time. I knew that I wanted to have a more traditional job, not a more student research assistant sort of job. So at the same time that I was applying to and got accepted to the UIC School of Public Health, I found a job in the paper, again, how we found jobs at the time, for a part-time health policy analyst position at the American Academy of Pediatrics. So I was working in that position 3 days a week and going to school, not quite full-time. So it took me about 2.5 years to finish. Most of my classmates who were going full-time, it was a 2-year program.
And what in the MPH helped you with what you were doing at the American Academy of Pediatrics? What were your responsibilities there, and did they change over the years as you had acquired your MPH?
Yeah, so I think that I was fortunate in having this job as a health policy analyst at the American Academy of Pediatrics at the same time I was getting my MPH. I was able to do some of my coursework on topics that I was working on at the time. And I was a health policy analyst working on health information technology issues. And so, you know, doing this starting in 1999, the focus of what I was working on a lot was the Hipaa privacy rule. It had just been proposed at that point. And so I was spearheading the AAP's response on it and looking at how it would affect the practice of pediatrics, and in particular, how the Hipaa privacy rule would affect adolescent confidentiality. And so I was really able to, you know, undertake that work, applying this growing public health knowledge that I had. I was also able to apply a lot of the information I had learned about reading policy proposals and summarizing them through my work with the state legislature. But when I would really start applying what I learned in my MPH was when I moved to my next job at the American Academy of Pediatrics, where I started serving as a staff person for the AAP's injury and violence prevention activities. So as I was finishing up my MPH, I needed to switch to a full-time job, but I really wanted to stay at the AAP. And so I switched to essentially the same type of job functions, but working on injury and violence prevention. And there I was involved in things like program development and evaluation, health education, policy efforts, looking at the injury prevention epidemiology, you know, all of the core things that I had learned through my MPH program, I really had a chance to apply through my work in injury and violence prevention at the AAP.
Why that area? They assigned you, you developed it, what?
Essentially, it was the job that was open. There were two jobs open at the time that were doing the same type of work that I did. One was on environmental health and genetics, and the other ended up being injury and violence prevention. I actually thought that I wanted the environmental health and genetics job. Given my science and biology background, it felt like a bit more of a natural fit. But that hiring manager, frankly, was just kind of slow to get going on the interview process. I needed to switch to a full-time job, and the injury and violence prevention job was the one that panned out first. And so I shifted to that role and absolutely fell in love with the field.
So that became less, well, not less of a job, but that became the beginning of clearly a passion of yours and a volunteer activities as well outside of work, where you eventually became the chair of this Illinois Coalition Against Violence, etc. Why don't you tell us how that developed, and did that, well, just go ahead. It's all yours.
Yeah, I think, you know, I was really lucky in working on injury and violence prevention at the AAP. A lot of the work of the AAP is highly clinical, and so the staff members who are non-physicians serve in a lot of kind of administrative and organizational functions to support the role of the pediatrician experts. And on injury and violence prevention, the expertise of the pediatrician volunteers was certainly incredibly important. But for a lot of it, I was able to get more deeply involved than some of my colleagues were. And so I had this chance to just kind of get really, really deep, be really creative. I know when I was looking at who had signed in for this, I saw Dr. Karen Sheehan in the list of participants. So she and I first met when I was working at the AAP. I just worked with this amazing group of volunteers, and we were able to collaborate and really think outside the box on big, important initiatives to help address this leading cause of death of children in the U.S. And then towards the end of my time at the AAP, I would, so this was, I left the AAP in 2011. And so at the time, there was a lot of increased attention on violence in Chicago. So in the fall of 2009, Darian Albert, who was a student at Fenger High School in Roseland, was beaten to death outside of his school. And someone caught it on video, and the video went viral. So this was on the south side of Chicago, and this was, the first year of President Obama's term. And so from the kind of national and international perspective, this had happened in President Obama's backyard. And so there was just this heightened interest and having worked on violence prevention and worked on addressing violence as a child health issue, as a public health issue, and then seeing this happen in my own city, I really wanted to get more deeply involved. When I was at the national AAP, at a national organization, you get a lot of opportunity for really broad reach and for sort of instant credibility, but you don't necessarily feel super connected to the work that you're doing. It's all very much at arm's length. And so even though I knew that I still wanted to do policy type of work, right? Going back to this idea that I didn't have the temperament for any sort of direct service sort of role, but I wanted to do it in my own city. And so that was sort of the shift to when I started doing the work in Chicago and was really able to increase my volunteerism and civic engagement on the topic. So I talked to Dr. Sheehan, and she had mentioned in a couple conversations that Lurie Children's, or then Children's Memorial Hospital, was interested in doing a lot more community-based violence prevention work. Lurie Children's had great success with CLOC, the Consortium of Lower Obesity in Chicago Children, and really wanted to apply that model to violence prevention. And so we were able to talk, and I was able to join the staff of Lurie Children's to head up that effort of creating, at the time I was hired, we called it CLOC for Violence Prevention. It ended up becoming Strengthening Chicago's Youth, or SCHI. And so SCHI really serves as a convener and a connector in the violence prevention space. And so as someone who was starting up an effort that was all about connecting and convening, it was really important for me to get out and about and going to different events, getting involved in different organizations. And so a lot of the civic engagement was a natural and important part of being able to do that work in my role at Lurie Children.
All right, a separate small question. What's peacekeeper training, and what was that all about, and how was that offered?
Sure. So restorative justice is really an important part of how we in Chicago, Cook County, the state nationally, but really Chicago's done a lot of innovative work around restorative justice. The idea is that instead of a justice system that just punishes people, restorative justice is about repairing the harm that's been done. And harm is complex. It's not just one person doing something bad to another person, right? A lot of times, the person who is the perpetrator of a violent act or a crime has themselves been harmed and gone through a lot of trauma. And communities can be harmed by the crime and violence that happen in them. And so restorative justice takes this much more holistic approach. Instead of just focusing as much on like, what did you do? It focuses a lot more on why did you do it, and how can the harm, again, viewed more holistically, be repaired? And so one of the really important tools in restorative justice is something called a peace circle, which is a structured form of discussion to implement this restorative justice philosophy. And so I and many other restorative justice practitioners in Chicago have gone through a 4-day Peace Circle Keeper training to support implementation of that approach.
So you remain involved in those kinds of voluntary activities as well in your current, despite your shifting jobs.
Yeah, absolutely. And restorative justice really has become a pretty official part of the Cook County justice system. There's a restorative justice court that was implemented a couple years ago in North Lawndale, and there are a couple other neighborhoods that are in the process of getting restorative justice courts off the ground.
So, watch me lose my train here. I had another. Oh, I know why I'm losing my train. I wanted to make sure that all the participants knew that these questions I'm asking are just stimulation. And we're expecting you to chime in on the QA, not on the chat, on the QA part of this. And as soon as you do, we will start to be responsive to your questions. Both Becky and I can see those. And I will slip them to her and then move them to the answered section after we do that. But I just wanted to mention that because we've opened up a lot of areas. We still have some more to go, but don't feel that you're waiting for the silence at the end of what we're going to do. Chime in whenever you want to do it. So my question is, and I think it's one of the issues on global health issues that I know it's hard to convince students sitting on the Gold Coast in the luxury environments of Northwestern, in the medical center, et cetera, and the learning settings there, as to how they can contribute to major social issues, such as the ones you are describing of violence, et cetera, where it appears that the real gnawing problems and the most pressing problems are in communities several zip codes away, as David Ansel would put it, in which the picture of life and death and the public health challenges are quite different than those perhaps on Michigan and Huron. How were you able at the American Academy of Pediatrics and then at Lurie to be able to begin to contribute despite those differences and barriers, if you will?
Yeah, so, I'm a policy wonk, and most of my volunteerism, most of my civic engagement has been really in the policy and advocacy space. And I think this is something that has always been part of public health, but is increasingly so. And I think it's something that students have always been leaders in, but increasingly so. And that's something that I would encourage anyone who is a public health professional, anyone who's a trainee in a public health discipline to really be looking at. So those disparities that you mentioned, they didn't happen accidentally, right? Chicago is probably the most segregated city in the country. And those disparities, the higher levels of violence, the poorer health outcomes, the lower educational attainment in Black and Brown communities were all disparities that were created over generations of policies that disinvested in those communities, that marginalized people in them, that disproportionately incarcerated people of color. And so I think we all have a role to play in really raising our voices to not just implement policies that kind of sit on top of generations of bad policy, but really dismantle and repair those bad policies. so perhaps a really great, very timely example is that yesterday, the Illinois General Assembly passed a bill to ban cash bail in Illinois. It's the first state to pass legislation to do so, and we expect that the governor will probably sign it. You know, I work in the Cook County Sheriff's Office, and Sheriff Tom Dart was the first sheriff in the country to call for an end to cash bail. The idea is that someone's access to funds has no bearing on whether there are risks to public safety or not. So we have people who are sitting in the Cook County Jail because they can't pay a few hundred or a few $1,000s that they would need to leave the jail. On the other hand, you could have someone with a lot of access to money who could be a danger to public safety and should be held pre-trial, but they're able to walk out because they have access to be able to pay their bail. So Illinois is just one step away, the governor's signature, from completely abolishing that practice. So it's a great example of where you can apply this public health lens of really looking at the problem through a lens of data and epidemiology, and come up with solutions, programmatic or policy solutions, to bring to bear to solve these complex societal issues.
So you raised the current job, and what led you then from the secure job basis within the healthcare community, respected institution, Lurie Children's, etc., in town, good platform to move ahead on all of the things you've been discussing, to leave there and to become the first and only master's in public health person working for the sheriff's department, if you will, in the belly of the beast, per se, around some of these issues. What brought you over there? What is the job? What is the spectrum of the job there? And how is your work different? Now that I've made a whole list for you, how is your work different than, let's say, Dr. Manella and the others at the Cook County Hospital Health Services, Shermack Health Services, as many of us spent time working at the jail, but as providing services? You're doing something else. Please tell us what that is and why it's exciting.
Sure. So first of all, I'm actually not the only Master's of Public Health at the Cook County Sheriff's Office. There are probably about half a dozen of us. I am the only one who's in an executive role. And in fact, I actually just hosted a newly minted MPH. We have a corrections officer who just finished her Master's of Public Health, and she did her MPH practicum with me. If anyone is looking for a practicum, I always love hosting students, happy to do that. So I loved my work at Lurie Children's, the effort to create Strengthening Chicago's Youth, and was really proud of what I was part of establishing. And frankly, the team was in a really good spot where I felt like it was the right time for me to move on to the next challenge. And a lot of what I love the most is continuing theme, and what I keep saying is the public policy work, and in particular some of the legislative advocacy work. And so the opportunity to move to a new setting where I'd be able to take my work on addressing violence as a public health issue to a different level, and get more steeped pretty exclusively in the public policy work was very appealing. So sort of elevating, going from addressing violence as a public health issue to truly looking at the intersection between public safety and public health. So I was originally hired, and I began working at the Sheriff's Office just about a year ago. And so what I was hired to do was essentially to be the quote unquote ideas person. so looking for innovative policies and initiatives that we could develop and implement, bring to scale, looking for innovative policies that we could be advancing locally in the state, looking for kind of that connection between the innovations that the sheriff's office had gotten off the ground and then how to make those more sustainable and spread more widely through laws and regulations. So I've still continued to do that work, especially because of my background on violence prevention and my background in public health. Probably do that mostly with relation to mental health and to gun violence prevention. But then, of course, in March, everything changed, right? So Cook County Jail is one of the largest single-site jails in the country. And the sheriff's office is a very large employer made up almost entirely of essential workers who can't work from home. And so we knew that we needed to really kick into gear in undertaking every possible effort on controlling the spread of COVID in the jail among our employees and detainees and in the other settings where our essential workers work. And so I work very closely with the folks who run the jail. And you mentioned Dr. Connie Manella, who's the head of CIRMAC Health Services, which is the healthcare provider for detainees in the jail. Work very closely with them. So the distinction between my role and Dr. Manella's is very much the same as the distinction between healthcare and public health often is, right? Dr. Manella is charged with providing the best quality clinical care to her patients that she can. And I'm playing this public health role of sort of looking at the policies and systems that allow her to do that.
The Sheriff's Department has, and its personnel have various functions within the county. The one we're discussing now, it has to do with the jail itself and the running of the jail facilities themselves. There are, of course, the courts officers, usually largely ceremonial, but also in settings in our current conditions, if you will, where they become protective. And then there are, as you know, a section of the sheriff's officers that are doing true police work in communities around the county of Cook. Some that don't have their own police forces, and others that, one reason or other, they're interacting with a significant amount of help from the sheriff. Do you find your advocacy efforts with respect to violence, etc., impeded by interactions with that kind of agency accelerated? Are you able to raise things within, again, the belly of the beast that you wouldn't otherwise? Do you find that the agency as a whole is committed to this kind of violence as a public health issue? How much progress have, no, I don't want to ask you that, that's a policy issue. But are you able to move ahead from that vantage point? How has your MPH equipped you to do that?
Yeah, it was actually one of the things that really drew me to working at the sheriff's office, and one of the reasons why I think that the sheriff was really interested in hiring me. So at the sheriff's office, we do house the Cook County Sheriff's Police Department. It's the third largest police department in Illinois after the Chicago Police Department and the Illinois State Police. We are responsible for policing in all of unincorporated Cook County, so that's a quite large population that's covered only by our Sheriff's Police Department. We also serve as the police force for the village of Ford Heights, which is a very impoverished, under-resourced community in the south suburbs that a number of years ago, essentially their police department folded. And so the sheriff's police department stepped in to provide policing. And then we provide policing in partnership with the Chicago Police Department. We're in two districts in Chicago now, in the 15th district on the west side and in the 6th district on the south side, where we work hand in hand with CPD to complement their kind of routine policing functions, but also the community engagement and investigatory functions. And so, you know, when I worked at Lurie Children's with Sky, we collaborated very closely with CPD. You know, in public health, I think some people have the idea that a public health approach to violence prevention is somehow an alternative to a law enforcement approach to violence, and that's not the idea at all, right? Public health is inherently multidisciplinary. A public health approach to violence is inclusive of law enforcement. And so I was very excited about the idea of getting to work not just with a police department as partner, but really as co-workers. Now, the Cook County Sheriff's Police Department, you know, does operate as a police force, but ultimately at the end of the day, we all report to Sheriff Dart, who is certainly, you know, one of the most progressive sheriffs in the country. And so I think that really bears out in how we approach policing. So the Cook County Sheriff's Police Department has been pretty innovative and at the leading edge in terms of things like use of force policies and community engagement. And so it's been really exciting to get to be part of that. And I think especially when it comes to addressing gun violence and how we can bring more data to bear on getting guns out of the hands of people who shouldn't have them, but also, you know, going upstream and trying to interrupt the pipelines of trafficking guns. That's been a really exciting area to be involved in.
So my last question on that, then I'm going to switch over to some of the questions we've gotten, specifically beginning with the ones about career. But it's part of your job participating or within the interface between the department and communities involved, either being policed or some of the other functions, as well as some of the specific issues you've gotten to already with us?
It's not something I have a lot of direct involvement in. Because of my work with Sky, I do have a lot of connections with community-based organizations throughout the city of Chicago. And so I do frequently facilitate connections to my coworkers who are doing more of the on-the-ground community engagement work. I don't know if it hadn't been for the pandemic, maybe I would have had a chance to be more part of that, but certainly our you know, on the ground community engagement work had to inherently look a lot different. And you know, for safety reasons and trying to control the spread, you know, we do have a lot of community presence, but it looks different than it would have otherwise.
Thank you. So the question here is, let me paraphrase it, shrink it a bit. Describing your role as an ideas person in leading innovation and proposing new ideas and systems. Was it apparent in the job description when you pursued your role? How did you know when you were applying that that's what they wanted from you, as well as what you wanted to be doing? If someone is looking for that kind of work, but in a different area of public health, global health for one, what kind of keywords or characteristics of the role should I keep an eye on? For I also recognize you're an executive and I'm more junior in my career now. So what advice do you have with respect to looking at Indeed.com or whatever?
Yeah, I think, so as more of an executive role, I was able to, the previous chief policy officer of the sheriff's office, and I did not directly replace her role. I took on some of her functions, but when she moved into a different role, I was able to connect with the sheriff's office, and essentially my role was created for me. So there wasn't a job to look for. But the way I got to that point in my career was to be this ideas person, was this having a well-rounded public health career until that point as possible. So when I worked at the American Academy of Pediatrics, I really got to be such a multifaceted public health professional. I had policy responsibilities, I had health education responsibilities, program development, evaluation, budget, staff supervision. And so I would suggest to move in this direction, looking for a job description that has lots of different facets to it, where it's not just in one of the essential functions of public health, but cuts across many of them.
I just slipped off. Here we go. Let me bring you then to some of the more policy issues here. One of the questions being asked by faculty member is, what about your thoughts? And in fact, it's one of the arguments about this current bill you've been talking about for reform that just passed Springfield. The argument is that if you don't charge cash bail, really that's the same thing as the demand to defund police departments. What is your approach with respect to the demands about defunding, as you are basically this kind of an advocacy person, but from within the department?
Yeah, so it's interesting. I've been very involved in this response. There was a resolution that was adopted by the Cook County Board that calls on defunding the Cook County Sheriff's Office, essentially. And really, I think what that means at the heart of it, and we talked to a lot of Cook County Board commissioners about this. We talked to the original sponsor about it. A lot of this is the idea that resources should be shifted away from traditional functions of policing and running jails, and shifted more towards positive supports in the community. Now, this has been essentially what Sheriff Dart has been doing since he began his career. So a really good example, and when you were reviewing the functions of the Sheriff's Office, one really important one is that the Sheriff's Office has a very large civil process unit. So we have sheriff's deputies who serve orders of protection and other civil process, but we also enforce evictions. So we serve people when they're being evicted by their landlord, and then if they need to be forcibly removed when that eviction is ordered, it's the sheriff's office that's responsible for that. So in 2008, during the mortgage foreclosure crisis, the sheriff was really concerned about this, right? There were people who were being evicted, even though they had paid their rent, right? Essentially, the property owner, the mortgage holder, lost their property, and the bank was evicting the tenant, even though they were current on their rent. So, the sheriff just knew this was wrong. It resulted in a host of policy changes, but one of the other things that resulted in was creation of an eviction social service team in the sheriff's office. It still exists today. For a lot of people who are being evicted, it's because they experience multiple vulnerabilities. So maybe they're struggling with mental health or substance use issues. Maybe they're struggling with health issues. A lot of people who are evicted are elderly people with complex medical needs, and they just kind of haven't been able to keep up with their rent and caring for their home. And so this eviction social services team helps to meet the needs of those those folks, right? So that's not a traditional law enforcement function. So I think what I see is that the sheriff's office has essentially undertaken its own mini defund effort within the office. And that's taken the sheriff, 14 years to do. And so all of these things, we would love to see the population of the Cook County Jail reduced because fewer people need to be in jail. We would love to see less need for the police department because there's less crime. But it can't happen overnight. And those programs that we offer through the sheriff's office are very much part of trying to overall reduce the size and scope of our criminal justice system.
So let me switch you a bit to the national policy level for a moment with a question from one of the participants who reports, of course, what we know, and that is the CDC was prevented in the last several years from doing research on gun violence as a public health problem in the theory that what you don't know will hurt all of us. But that's another question. The absence of CDC support and its involvement in this problem, what are the practical problems that is introduced for you in the kind of efforts that you and the Sheriff's Department are trying to make in this area?
Yeah, the problems from this are astronomical. Our inability to really adequately characterize the gun violence problem and to adequately know what solutions work, in particular what policy solutions work, is devastating. Like, I cannot even tell you a good estimate of how many guns there are in the country. So compare this instead to motor vehicles, right? So motor vehicles and guns are both entirely human-made devices, and both cause thousands of deaths in the US every year. So the federal government conducts extensive research on motor vehicle safety. The federal government has for decades invested millions and millions of dollars in really robust surveillance systems around motor vehicle injuries. So for example, in the 90s, as airbags really became common, there was a rash of babies installed in rear-facing car seats in front of a passenger airbag, a number of babies who died. And so the federal government was very quickly able to identify this as a problem and do a lot of education about never putting a baby in the front seat of the car. The federal government invests extensive amounts of money in education about motor vehicle safety. And there are a lot of federal regulations requiring various things in motor vehicles to ensure safety, right? Seatbelts and airbags and electronic stability control, and all of these things are regulated by the federal government because they knew to mandate them based on the research and surveillance they had done. And then there are extensive federal policies that force states to have effective motor vehicle safety policies, right? Like the 0.08 blood alcohol level that all states have to mandate. That's essentially the federal government saying, if you don't adopt this as law in your state, we're going to withhold significant federal highway funds from you. It's a very effective tool. And we've used none of those tools when it comes to gun violence. And so it's an example of what this could look like and that we have completely failed as a nation to do.
So I guess I get a chance without another question on the list there to go to my favorite area of questioning. This is the Hans Conried questions for Humphrey Bogart in Casablanca, just in case anybody wants the historical reflection. After going through his book on Humphrey Bogart, he says, "We know a lot about you, Ricky." And after Humphrey Bogart says, "Are my eyes really brown?" he runs down a list of activities, implication of which was that Rick is a committed anti-fascist within World War II, et cetera, et cetera. So we have run down a list of your activities now for the past hour. And there's a string that runs through these activities, and that is race and racism, my favorite topics in this country. And each one of these activities are clearly within a dynamic of prioritizing the question of combating racism, and with race as an underlying major issue, social issue. And I'm wondering, yet without expressing it within our discussion. So I'm wondering how you became this committed anti-racist, how that the question of racism impacts on your professional decision-making and your career so far, and where do you see that going? And take all the time you want, and we'll wind up within that context.
So I think a lot of people doing policy work, and certainly this was the case of my role at the American Academy of Pediatrics, sort of hold ourselves at a distance from the work that we do, right? It's them, it's all third person. It's never we, it's never I. And when I shifted from doing this national policy work to doing much more community-based work and convening work with Strengthening Chicago's Youth, it was very clear early on that I needed to figure out a way to be more authentically engaged, right? Not just engaged from the head, but engaged from the heart too. And so I started going to seminars and workshops on transformative justice. I got trained as a Peace Circle keeper. And through a lot of this, I really got to have not just an academic from the head kind of grounding in how disparities and how racism kind of is intertwined with violence in Chicago, but really a from the heart perspective on it, right? I do not have lived experience with violence. I have a lot of privilege. My white privilege is obviously an extremely dominant part of that, but there are all sorts of other privilege that I have. And so as I met with people in this and explored how to really authentically connect with people, it just addressing racism and being a true ally was so part and parcel of what I had to do. So I was able to explore that a lot in the first few years of Strengthening Chicago's Youth. We very intentionally, as a team with Strengthening Chicago's Youth, explored that together. Probably one of the biggest turning points was, so we were a pretty small team at first, and I remember the day that George Zimmerman was acquitted for the murder of Trayvon Martin, and we were hosting a few interns at the time, both of them public health students, actually, MPH students from UIC. And we were all just having a really hard time grappling with what had happened. And I think we spent about 2 hours just talking together about our feelings, about what we could do as Sky to help address this, what we could do as individuals to address this. And from there, that like authentic but solution-oriented conversation became a really important part of how we worked as a team, of how Sky operated as an organization. I would say the other really formative opportunity I had was that in 2017, 2018, I was able to be a fellow in Chicago United for Equity, where I really learned a lot about the tool of racial equity impact assessment, which very nicely spoke to me as a policy wonk and a data nerd to have like this formal tool, this discipline to apply an assessment tool to racial equity. And I've really continued to be involved in a lot of work through Chicago United for Equity, including conducting a racial equity impact assessment in my own neighborhood in Uptown in partnership with a number of community organizations.
Well, thank you. And we have a question as part of this. What is privilege? Why can people of less privilege use words describing each other, but people with more privilege can't? I'm not sure I quite understand it, but I toss it to you.
Yeah, that's fine. I can answer that question. So I think there's in the question, I think there are two things that are being confused: privilege and racism. So privilege, we all have some form of privilege. Privilege is something that gives you a little bit of a leg up. So for me, it's being white, it's having grown up middle class, it's having grown up in a two-parent household, it's having had access to a really high quality education. For someone else, it might be that they're tall, or so I have terrible vision, right? So for someone else, it might be their 20/20 vision and never having to wear glasses. We all have some form of privilege that gives us a little bit of a leg up on other people in whatever that dynamic is. You know, certainly some forms of privilege are dominant over others, and white privilege is a very dominant form of privilege in this country. So racism, though, and racism can be either like at the individual or at the institutional and systemic level. Racism involves a combination of two things. One is a prejudice or bias against another racial group. But the other really important dynamic that is it's an essential part of the definition of racism is that there's a power dynamic in play, right? So essentially you have sort of a ranking or a spectrum of power. And so while someone with from a less privileged racial group can hold biases or prejudices against people from a more privileged racial group, racism only works, you know, from the more privileged can be racist against the less privileged. And so I think all of our obligations to be anti-racist stem from that, right? That the more privileged group shouldn't be contributing to the oppression of the less privileged group and should be working to break down those power structures that are inherent in racism.
And with that, we'll leave it. And I want to thank you very much for joining us today. You hit exactly the points I hoped you would, and I hope this has been useful to everybody else who's participated. And thank you all for joining us. The next one in this series will be at the end of February. February 25th, I think, is the exact date, in which Sir Michael Marmot from the University of London will be joining us to discuss social determinants of disease and health, a topic that he has brought throughout the world to the public health community and the medical community more specifically, and for which he headed the commission for the World Health Organization that developed the area and produced the precedent-setting report. So we hope you all will join us at that point, and we'll give you further advertisements later on other events in future. Thank you all very much. Thank you, Dr. Ackerman, and we'll see you next time.
Thank you.
Thank you.